Congratulations, your baby is now 4 months of age and is full of excitement and curiosity. Their personality will start to shine through. Those hazy first few months will have disappeared, and this is definitely a fun age for your baby and you as parents. You will undoubtedly still have many questions about your baby's routine and development. It can be tempting to Google and find out answers to all the questions and concerns you may have, but be aware of false news and misinformation, which can be dangerous and harmful for you and your baby. I'm Dr. Gina, and over my 15 years career as a paediatrician, I have managed thousands of newborns and babies and have helped parents navigate those tricky first few years. For more evidence-based videos on child's health and parenting, please like, subscribe, and turn on notifications. In this video, we will discuss exactly what to expect when your baby is 4 months of age in terms of sleeping, feeding, and development. We will also discuss essential red flags to be aware of and what we as parents can do to boost development at this age. Sleeping. Your baby will be needing around 14 to 16 hours of sleep in a 24-hour period. By this time, they will typically have around 2 to 4 long sleep naps during the day, lasting anywhere from 45 minutes to 2 hours. Some babies may be able to sleep 6 to 8 hours at night time. Others may still be waking 1 to 2 times a night for feeds. Baby sleep patterns vary a lot at this age, and longer stretches at night will only happen if your baby is growing and feeding well during the day. Feeding. At 4 months, babies typically take around 24 to 36 ounces of milk per day, which is around 720 to 1,000 mils. Formula-fed babies will take this in around 5 feeds and be taking roughly 180 to 250 mils for each feed. Breastfeeding babies will still be feeding slightly more often, taking around 5 to 6 feeds a day. If your baby is nursing every 2 to 3 hours, then try and build up how much they take at each feed or offer split feeds. 4 months is still too young to offer solids as baby's digestive system is still too immature. If you are contemplating early solids, talk to your paediatrician first. Development. Physical development. Your baby can hold their head up 90 degrees when on their front and can start to push up on their elbows. By now, they'll be a pro at tummy time. Some babies still resist tummy time, so keep them distracted when they get restless and try and build up by a small amount each day. Your baby may be able to roll one way. Usually it's from front to back. If they're not rolling yet, don't worry, they'll be doing it very soon. Fine motor and vision. Your baby will be bringing their hands to their mouth and will be showing more purposeful movements by grabbing and reaching for toys. They'll be watching faces very closely and following moving objects from side to side. They'll also be able to hold objects in their hand and may start to shake them. Speech and language development. Your baby will be squealing and giggling enough to make your heart melt. They'll be so vocal at this age, and when you're talking, they'll be turning towards you. Social skills. Your baby will be smiling at people. They'll start to show discontent every time you stop interacting with them, and they'll be trying to copy your facial expressions and watching your face intently. You should consult your doctor if you notice your baby doing any of the red flag things. Not watching things as they move, not smiling at people, not being able to hold their head steady, not making any cooing or any vocal noises, not bringing things to their mouth, having trouble moving one or both eyes in all directions. Most of the time, everything will be fine and baby may just need some close monitoring, but early identification and intervention is key. You know your baby best, so act early if you have any concerns. Your baby's brain is growing exponentially at this age. Repeated tasks and activities help strengthen connections, and underused connections are pruned away. You can have a huge impact on how your baby learns and develops. For your 4-month-old, try the following activities to boost their development. Cuddle, talk, and interact with your baby during feeding, dressing, and bathing. Start setting routines for feeding and sleeping. Show excitement through your voice and actions when your baby does something, such as making noises or smiling. This rewards them. Talk, read, and sing to your baby to help expose them to language. Give your baby lots of supervised tummy time. Use age-appropriate toys such as rattles, baby-safe mirrors, and toys with textures to encourage your baby to explore. At this age, sensory toys are best. Encourage baby to explore surroundings by using an activity gym so they can reach out and interact with toys and objects. I'll see you next time when we discuss your baby at 6 months. For more evidence-based parenting videos, don't forget to like and subscribe. Bye.